Everybody. I'm Peter Forsyth from the Moffitt Cancer Center, where I'm the chair of neuro-oncology, and trying to discover and treat leptomeningeal disease is my life and interest. I wanted to tell you today about a clinical trial that we're doing that we're pretty excited about, and that is where we educate your own immune cells to attack and kill the tumor cells in the leptomeninges. We think here that we really need to start with the idea that if we understand this better, we can actually cure these tumors, which is a little much to expect at the moment, but I think we're making real progress. And we need to understand the biology better. So this is a very complicated slide. I don't know if you can see my pointer, but this is immunology in 1 minute or less. So there's a whole bunch of immune cells. Now here, we think what we're doing is we're activating your own immune system. We're using your own immune cells and we're training them. We're training these things called dendritic cells, and they're more or less like Paul Revere, where they are the early warning system in your body if there's something going wrong, like an infection or a tumor cell. And these are these yellow cells here, but their job is to run around and say, look, there's something going on here. There's these proteins that shouldn't be there. We need to do something about it. There's these other cells that people might not remember MASH, but there was somebody called Radar, and he's like the CD4 cells. These are cells that help turn on the immune system. They're less able to kill stuff on their own, but that's another long story. And then there's killer cells that I think is the Terminator, where they're of course the most famous because they just kill things directly. And then there's the memory cells, which are basically B cells. So there's this complex interaction where these Paul Revere alerts the cells, it turns on the helper cells, and then these interact with these B cells that make antibodies. And now antibodies are the memory, because you want your system not just to attack the cancer cells once, you want them to remember how to do it. And then if it starts coming back, you want to have that instant reaction to deal with it. So that's the theory. Now there's practical things about doing this. To collect your immune cells, we do this through this process called apheresis, where you have an IV or a port, and then your blood is basically returned to you, except we take out some of these immune cells, these Paul Revere cells, we stick them in a dish with a bunch of proteins from your tumor, and then turn them on with this cocktail of cytokines and chemicals that turn them on. Because again, we're educating the cells. Look, these are proteins that shouldn't be here. You need to attack these and get all your friends together and kill them. So that's kind of how that works. This is a way too complicated slide, but to be on the trial, you have to have a diagnosis of leptomeningeal disease through cytology or molecular markers. There's all this testing with MRIs and blood draws, and of course that apheresis. Then we have to produce the vaccine. It takes about 10 days to grow those Paul Revere cells. We need a whole bunch of them, so we have them multiply. And then you get these dendritic cells directly into the CSF through an Ommaya reservoir once a week for 3 months. So the purpose of this, it's a phase 1 study, and the purpose is to determine safety. And we also want to look for early evidence of efficacy. And am I eligible? Well, if you have HER2 or triple negative breast cancer and have positive cytology, then the answer is yes. You have to be in reasonable shape, be kind of independent, be out of bed most of the time. Now, ignore this slide, which is way too busy, but out of the first 6 patients, we did some complicated immunology tests that I'll show you. And the average, 1 patient died from radiation-induced brain damage, and the rest are all alive. And as of today, that's 15 months out from their starting the trial. So that's really significant in terms of our field. And I'm going to maybe go 30 seconds over time, but this is an example from Heather, who's given us permission. And of course, many breast cancer patients with leptomeningeal disease were young and way too young, but In the top panel, we look at the cells that are in the CSF to see if we're having the effect we think we are. And the top panel is before treatment and the bottom panel is after treatment. The details don't matter too much, but it just shows you the kind of things that we can do. Some of these little dense blots are tumor cells, and you can see that most of them are gone after treatment. There's a few of these little blue guys here that we need to figure out, but there's a whole bunch more of these B cells, and those are the memory cells. So we really want to have those. And there's a whole bunch more helper cells and killer cells. So it looks promising so far. We have, I think, 3 slots left on the trial, by the way. And if you're interested, this is the way to get a hold of us. You can look at this on the websites to find it and contact the study coordinator. This is a patient support group, which I'd strongly encourage you to look at, or the breastcancertrials.org. With that, I'll say thank you very much for listening.